Well, let's get right to our first guest, Todd Malan. He's a founder, chief scientific officer, and of MyStemCellTherapy.com. Todd, welcome to the show.
Well, thank you. Thank you very much. Happy to be here.
So, Todd, tell me a little bit about, we're getting a lot of information about stem cells today. But before we jump right into that, tell me what a CSO really does. What is his duties?
Really, the significant part is making sure that we're staying in compliance with the FDA's guidelines and rules, and then assuring that as emerging technologies and techniques become available, that we're constantly reevaluating the way that we're doing things to make sure that we're using the best possible techniques available, not only to ensure the best safety for our patients, but also to ensure the potential best outcomes. And then making sure that the standard operating procedures are continually being updated based on this emerging science, which changes on almost a daily basis.
So tell me now a little bit about your history and how you got into this position to be able to be the founder of this company and be a CSO.
As a physician, initially as a cosmetic surgeon physician, my focus and my interest was on fat transfer technologies. How could we potentially take fat from one area of the body and move it to another, not only for cosmetic implications, but also for patients with traumas or injuries, patients with severe burns or wounds. How could we help fill that tissue in by utilizing their native fat? And the problems were in the past that the fat just wouldn't survive, and it would take multiple surgeries, and the end result was variable based on how well that patient's fat actually survived in whatever area we're injecting it. And then we started to see some interesting studies coming out of Japan where they were utilizing fat-derived stem cells to enhance or enrich the fat to improve the overall survival. And so in October 2009, we were the first center in the United States to start utilizing those techniques that they had developed in Japan, utilizing equipment that was actually designed by doctors at UCLA. And we started using this stem cell enriched fat grafting material. And the stem cell enriched fat grafting material was wonderful for utilizing for covering wounds or using for tissue areas where there was no tissue coverage. But then we started to see these amazing changes that patients were experiencing with their joints no longer hurting, with their autoimmune conditions like rheumatoid arthritis and lupus going into remission. Patients with neurological problems were starting to see resolution just from injecting these stem cells and fat into local areas. So in 2011, we started studies where we wanted to look at how effective were these stem cells from your own body at treating a variety of these different conditions. And from that time forward, we have been working in that realm of looking at how can we safely apply your own stem cells that are sitting in storage doing nothing. How can we give them back to you in such a way that they can have those types of benefits?
So basically, you and this is your company, obviously, you harvest that fat, and then my understanding is you spin it or something to get the stem cells out, and then you save them or freeze them for clients. Is that what's happening?
Yeah, so thankfully, a lot of other countries are ahead of the United States when it comes to stem cell technologies. I mean, we're about 15 years behind because of the FDA not having specific rules or guidelines to tell us how do we get this approvals. So I spent a year and a half outside the United States working and learning these techniques from doctors all over the world and bringing it back to the United States under phase 1 safety studies so that we could look and determine how are we able to use this effectively in the United States. But basically, your fat is kind of the ocean and the stem cells are the fish. So a lot of people get confused that we're sucking out fat and the fat is the stem cells. It's not. The stem cells live inside that fat layer. So we capture the stem cells. We don't really care about the fat. It's the stem cells we want. And then we can take those stem cells and concentrate them, and we can inject them as a paste into your joints. We can inject them as a liquid into your bloodstream. We can inject them into any particular area that we want to. And they're your stem cells. They haven't been modified. They haven't been changed. They've just been boosted, or they've just been increased in number so that you can have that fantastic repair mechanism.
Sure.
I mean, normally an individual has about 10 million stem cells floating around their bloodstream at any one moment. And with these therapies, we can increase those numbers to 100, 200 million. So it just enhances the natural repair that we all have by many, many times.
Todd, I want you to hold that thought. We're going to come back and talk more stem cells and how they're helping our bodies. We'll be right back with CEO Money. Okay, welcome back to CEO Money. Here with Todd Malan, Dr. Todd Malan. And we're talking stem cells. And actually, we haven't got into this. You just kind of briefly touched on it. The big difference in working out of the country and in the country, what the U.S. does, the FDA, how they're kind of holding things back. I understand you're involved in that push to try to change some laws, and tell me about what you're doing to help open up the stem cell business and actually helping people.
Yes, it's been a very interesting transition. I mean, in fairness, when we started seeing the technology, it was basically, the technology was moving faster than legislative changes could keep up with. And we started to see some amazing technological changes which were enhancing our ability to utilize these stem cells for a variety of conditions. The FDA really just didn't have any rules. And so from 2011 through 2014, we were constantly playing catch-up with one another. And then at one point, the FDA decided to take a stance that your stem cells were a drug. So once they left your body, they became a pharmaceutical agent. And therefore, as a person providing those stem cells back to you, I had to become a drug manufacturer with the rules and regulations and the costs that go into something like that. So it made it untenable for us to be able to do any further stem cell research in the United States. So as we began to focus, and many companies began to focus all of their research and development outside the United States, there was a push, a grassroots movement from patient advocacy groups and from physicians, and many of our colleagues, our physician colleagues that are now holding seats within the Senate and the Congress, decided to challenge the FDA to step it up and to come up with real good rules and regulations and guidelines to help us be able to move this technology forward. And as of the passing of the 21st Century Cures Act, which was in December of 2016, we now have, or the FDA now has, a mandate to come up with those rules and guidelines. And they have to do that prior to December of this year. And they have made a concerted effort to work with physician groups, to work with the industry, the biotech industry, to say, how can we do this, work effectively so that we can get this technology into the hands of doctors and out to the patients to be able to provide these potentially life-saving therapies. So it's been very challenging up until now, and now it's actually getting to the point where it's exciting because we're going to start seeing approvals of technologies. There hasn't been a single stem cell technology approved in the United States in 15 years.
Wow.
And now we're starting to see the first technologies getting ready to truly get approval.
Well, Todd, I know we're just about out of time, and I wanted to get so much more inside. I definitely want to have you back to talk about this, these important, huge strides you're making in stem cell therapy. It's very important. And so we want to make sure that people out there are able to reach you, go to your website, get more information about it, so they can get more informed and you can help them make the smart decisions. Tell me, how can people reach you?
Well, the website that we use for patient education and for patient information is the mystemcelltherapy.com. And that's really the focus of that website, is to provide that education so that prospective patients will understand what it means to do a stem cell therapy and what stem cells actually can and cannot do. So that's a good resource for them.
Well, I sure appreciate you being on the show and informing our listeners about stem cells. So it's mystemcelltherapy.com.
Yep.
Dr. Todd Malan, we sure appreciate it.
Thank you so much.
Okay, we'll talk to you again soon.
Thank you. Bye.
All right.